Basically, active immunity, speed of onset, parvo and panleukopenia vaccines are fantastic. They work wonderfully. And to say that you need at least 2 weeks before they are effective is also incorrect. With panleukopenia virus in a kitten that, again, does not have maternally derived antibody interference, within 3 days you can start getting protection. Possible almost in 4 days with canine parvovirus. You won't even be seeing titers yet at that point. So obviously there's other things coming into play in the immune system like complement and other things that are actually starting to confer clinical protection. So in the face of an outbreak, is it worthwhile to start vaccinating en masse? Absolutely. You're going to start protecting these animals pretty quickly. It doesn't take that long. So shelter-specific protocols, puppies under 4 months of age. Sometimes I say under 6 months because I don't trust people to age puppies appropriately. But we start vaccinating with a modified live 4 or 5 weeks of age. This is much younger than private practice, but we're trying to find those puppies that have no maternally derived antibodies. If they don't have it because mom didn't have any to give, at 4 weeks, it's going to be protected from that one vaccine. So that's what we want to do. And we revaccinate every 2 weeks. And we do every 2 weeks because that's the shortest period of time that we can do. If we do it too close together, they start kind of competing with each other just the way maternally derived antibodies do. So you do need the 2-week window. Do you need to do it that frequently once they're in private practice? Obviously not, but we're talking about shelters. And you go out to at least 16 weeks. I usually recommend, especially in shelters with parvo issues, to go out farther than that. Because some dogs, even at 16 weeks of age, will still be have enough maternally derived antibodies to interfere, A, and B, our aging ability for puppies isn't always that accurate. But really, how old am I? And some people swear they can age puppies really well. I'm not that good at it. Yes, you can use teeth, but every puppy's a little different. So you want to be sure that you're not stopping, especially in large breed dogs, because you think they're 4 months old. Once they are 6 months old, again, I like to err on the side of caution. In a shelter, giving a modified live vaccine, even in a dog that's never gotten the vaccine, that one vaccine most likely will confer protection. Now, if this dog is going to stay in the shelter, yes, it's a good idea to repeat in 2 to 3 weeks in case that first one didn't take, or the person giving it didn't give it correctly, or the vaccine was left on the counter too long, some reason like that. But in a lot of shelters where personnel time is at a premium, cost is at a premium, you can get away with just one vaccine in adult dogs. Exactly the same scenario for cats and kittens. I just say they're starting at 5 weeks, and that's just because I like to go the pound per month in cats, and I usually, if I go with 4 weeks exactly, the females are under a pound, and I like them to be about a pound, so I usually go at a pound. That's when I start vaccinating them. And again, every 2 weeks until at least 16 weeks of age. In a facility dealing with a lot of panleukopenia, I keep going. Now, hopefully, those kittens will be long gone and in a new home long before they get all these vaccines. And once they're in a new home, can revert to private practice protocols. Same thing with adults. As in the one vaccine should be enough. Ideally, repeat it, but you don't have to if money or personnel is an issue. I've never seen an outbreak in a shelter because this is what they're doing. But when it comes to who gets vaccinated, and I get a lot of questions about this because in private practice, this is very different. In private practice, we don't vaccinate sick, injured cats. But in shelters, absolutely. Every cat that comes in is stressed. Most of the dogs that are coming in are stressed. Yes, maybe their immune systems are going to be a little bit compromised, but chances are the vaccine will still work. We're protecting the herd in shelters, not just the individual. So if it's injured, I'm going to vaccinate that animal. If it's got a broken leg and I don't vaccinate it, gets parvo 4 days later, that broken leg's going to be irrelevant. Even ill ones, even if they've got mild URI or some other mild to moderate illness, I'm going to try to protect them against parvo and panleukopenia. It's those dogs and cats that are going to be very vulnerable. Even nursing, and I get a lot of questions about that. In private practice, I'm sure you would not do that. But if the mom gets panleukopenia or parvo, the puppies are dead anyway. You want to protect mom against parvo so that she can take care of those puppies. I have never seen it hurt a nursing dog or cat. Maybe if they get a little bit febrile in a day or so from the vaccine. I haven't even seen that with the current vaccines. But, would I suggest that to a breeder? Probably not, unless they're having parvo or panleukopenia issues. Obviously, anything over 4 weeks of age, even if they're exposed. If they've been exposed to parvo, a litter mate, and I haven't vaccinated it yet, I'm going to vaccinate it right then because, as I showed, onset of protection is pretty fast. Unless you're going to give anti-serum, this is really not going to happen in the shelter, and there's some evidence that this doesn't really help anyway. And pregnant cats, absorbed dogs, I would vaccinate. No, is it ideal? But again, you want to protect that the dam. I've never seen an abortion happen, and honestly, in a shelter, a lot of shelters abort pregnant animals anyway. Yeah, question. The question is about, especially, I guess, cats causing cerebellar hyperplasia with modified live vaccine in young kittens under 4 weeks of age or the pregnant queen. That's one of the reasons we recommend starting vaccines at 4 weeks of age or a pound. That's why I go up to a pound because of that. There have been studies looking at doing younger kittens, and they have not found cerebellar hyperplasia. However, I still wouldn't recommend it because we haven't really proven it one way or the other. Pregnant queens, that is the other issue, and which is why a breeder, I wouldn't recommend it necessarily. Somebody who wants a cat and it's pregnant and they want the kittens, would I necessarily vaccinate it? If I can get that queen out of the shelter, maybe I wouldn't. In a shelter, I have to protect the herd, so I would do it anyway. Plus, most shelters abort kittens. So it's not that many shelters that actually allow kittens to be born in the shelter, and I don't recommend that. So, yep. Any question? I'm sorry? Yeah, the question is about febrile animals, and yes, again, in a shelter, I would vaccinate. Could the fever result in an immune system that is unable to really respond to the vaccine? Theoretically, yes, that could happen. But the chances are that the animal is still going to respond to the vaccine. Will it get a little more febrile and sick? Maybe, but we're protecting the herd. I can't allow that animal to sit in the shelter unprotected. I have to balance it with the other animals in the shelter. I've vaccinated many cats with fevers, and they do fine, assuming that they're not already have panleukopenia or some other horrible disease that they're going to die from. It's not the vaccine that makes it worse. Would I do it in private practice? Probably not.